Good morning, everybody. Welcome back to Kalkstein Chiropractic. Carol's here today because she's been working on her film career and she wants to win an Oscar today.
Yeah, right.
You know what I'm saying?
Yeah.
Oh yeah.
Okay.
No, Carol came in July, and Carol, how did you hear about us?
Through the pastor of my church.
That's right, Reverend Lewis.
Yeah, Reverend Lewis.
And Reverend Lewis sent you in because he had good results with us, and he's been seeing Dr. Jeff for a little while. And from a chiropractic or a patient perspective standpoint, this is just a little side bit. We get people that walk in, that set up appointments. We get people that are referred in. We get people that are medical doctors that are referring their patients in to see us. We get car accident cases that come in to see us. So you've probably seen, we get athletes that are referred in by the athletic trainers. There's a broad group of people in terms of where we get patients to come in from. In Carol's instance, there was a patient that referred her in, a previous patient, right? And so that's nice. That's a good feeling to have someone come in and say, hey, I trust these people, come in and get help with them. Now, you didn't really know what was going to happen when you came in terms of what we could help with, right? We had that conversation early on in the treatment. She has had a history of vertigo, and it was for how many years?
20 years at least.
Yeah, so 20 years of vertigo. This is the really the life-changing portion of the treatment, in my opinion. There's certain tests that you can do to check to see if vertigo is coming from a problem in the inner ear, and that test is called the Dix-Hallpike maneuver, and the Epley's maneuver is the way to fix that problem, right? So we did Dix-Hallpike, and she's given us information in the past that it's helped her, but she's really scared of doing it. So the first time that we did it, we pretty much became best friends right off the bat, right? It was
Exactly. I thought I was going all over the room. It was awful.
It was awful. It's tough. So when you do Epley's maneuver and you have a positive indicator that that's the problem, especially in the beginning towards that treatment, when she says it's awful, the room spins. She doesn't have a sense of position. She's lying on her side, but she feels like the room just spun around, right? And to me, that's one really intense. And I'm with the patient pretty closely during those moments. I'm right there with them. I'm making sure she doesn't feel like she's going anywhere. I'm giving her tactile feedback to her back and to her neck and to her body so that she doesn't feel unstable, because everything is unstable, right? She has some type of awareness of a sense of stability, then it creates a little bit of ease in that moment, right? And to calm things down.
Yeah.
So that was what happened on the first visit that you came in?
I think the second.
Was it the second? So we did some light treatment in the first visit. I gently adjusted you. You came in with low back pain, right?
Yeah.
And so we did a subsequent treatments after that. I'd say about 4 sets of Epley maneuver probably total, and I educated her on how, with someone by her side, to do them at home as well, right? So she was doing them regularly. She had a huge fear of doing it. You can imagine going through that type of experience. Of course you're going to have that type of fear with it, right? So we took her through those procedures and eliminated the vertigo completely, to the point where she really only has what I would call a benign positional vertigo, where she's going from a seating standpoint or a laying down standpoint. She comes up quickly, she'll get it. She doesn't have the directional vertigo that you have with a Dix-Hallpike, which is more of an inner ear problem. So eliminated that and educated you on how to manage it on your own, and what more, you tell me, you feel more confident with that ability to manage that, right?
Yes.
And that's one of your biggest fears, is that coming back. But now you have a way of targeting it in a gentle way, right? Where you can just work it gently.
Absolutely.
So that's cool. That's really cool. So we deal with back pain, we deal with neck pain, but with some other problems that we come in from a manual therapist or a musculoskeletal specialist standpoint, that's one thing that we treat, would be a vertigo coming from the inner ear. So,
which I was very surprised, because I didn't know what a chiropractor did. I'd never been to one. So I figured you did back adjustments. And so when I found out you did vertigo, the Epley maneuver, and I'm so much better, I can't believe it. That was my biggest surprise coming here.
Yeah, this might tail off into a spin, because I'm in a talkative mode this morning, and my dad's about to run me out of here because I'm taking so long. So chiropractors are trained in a broad range of clinical skills. Now it's about your scope is whether you feel like you're clinically competent, that you have the training, and that you're practicing it with that background. So I would say that there's chiropractors that treat in a lot of different ways. That's something that I think that is confusing for the general public on the
It is. I didn't know you did exercises and
yes.
You know, to keep you
here in
strong.
Maryland, we have physical therapy benefits, so we are able to practice physical therapy. I have our masters, and we do a lot of continuing education on the outside in terms of weekend visits where we're going and we're learning new skills and new programs. But our clinical background is in treating injury as well from a PT standpoint. That's really been a huge help to the practice and our patients in the sense that it really provides more value. So she's doing. She came in. Let's start back here, Carol, because we kind of digressed a little bit about scope of practice. You came in with. You said, one, I want achiness in my low back to decrease. I'm worried about getting knee surgery, and I just want to walk with my husband more often. You've been coming to see us. This is your 14th visit. Your core is stronger. You've been exercising. You've been doing stability work at home. Your vertigo is going down. We've adjusted and not eliminated, but definitely decreased the amount of discomfort you have on your low back. And that's been there for a little while. That takes hard work, and we talked about that. And she's willing to grind it out. That's why I'm putting so much effort and work with her, too, is because she's willing to do the hard work. And then
and the dry needling.
You need dry needle your knee. We did it twice, and it really helped.
Yes.
Helped 3 times, and it was really significant in terms of the change that we had in that area as well. So I'm glad you're feeling better.
Definitely.
Let's go win that Oscar.
Right. Okay.
What would you say for someone that's interested in seeing a chiropractor but nervous about the experience or not sure what they can help for?
I've recommended one friend who's come in already, and I'm trying to get another one in here who has significant pain in her knees and back and everything too. Haven't gotten her here yet, but I'm trying. And I will tell anybody who says they're having back trouble or knee pain or whatever to come in, because I had no idea that you did all this, and it's been great.
Honored to help you. Really, really happy that you're here and you're working so hard. It makes my job very enjoyable. So thank you.
You're welcome.
Carol, let's go ahead. We got a couple adjustments to do here. So you're gonna stand on up. Last time you were in, Carol, I did an adjustment on your neck. You felt a couple of those pops. Did that feel better afterwards?
Yeah.
Okay. We're gonna start with you on your back. Okay. So there's different styles of adjustments that we do with different patients. So it's not by any means my touch and my approach to everybody's body is very different based off what I feel, based off what I see, and what my objectives are clinically. Okay. With her, when I do rotation of the neck, I'm very cognizant of that rotation. I want to eliminate any quick rotations. I'm using a little bit more lateral flexion when I adjust her neck, just because I don't want to aggravate her nystagmus or her vertigo. And she can kind of feel that movement already right through there. Let your shoulders loose. There you go. So it's more of a pull on that adjustment. Easier. Good. Good. And relax your hands. Good job, Carol. Very nice. Good. Breathe in. Exhale. Turn your head to your right. Easy. You got just a little pressure here. So Liam worked out 2 days ago. I was like, Liam, you need to go lift. You haven't been lifting lately. Usually when Liam walks around the room, it's silent. He's super sore right now, so he's stomping a little bit.
Just a little.
Just a little. He's like, he's a little unsure on that one leg. I'm going to bring you up, okay, Carol, and then you're going to go on your stomach. Awesome. And then come onto your stomach. Yeah, Liam, you just started getting adjusted too, didn't you?
Mm-hmm.
So, Liam said, hey, Doc, I want to get back into working out. I see him kind of reaching around for positions to get comfortable in. He's got a little bit of stiffness in certain spots. Now, Liam's fortunate, right? He's got access to musculoskeletal care right after he's done working for the day. In my opinion, why not take advantage of that? You can, who could get adjusted? I had some kids come in yesterday, like, I got some pain right here. I didn't know I could just come in and get worked on. And yeah, you definitely can, right? I'd say that if you're looking to improve, if you're looking to change the way that you move, the way that you treat your body in a conservative management, if you want to be around the mindset of that, I think it's helpful to see a chiropractor. Relax your shoulders. Good. Good, easy. So more compression with Carol. I'm really being gentle on her back. So she'll feel more pressure from my whole hand, and then I'm making an impulse very slowly, very quickly, but not a lot of depth over the areas that she's tight. Because if I just went up and tried to adjust her, her body would tighten up. Good. Right there, loose. Good job. Good, breathe in for me, Carol. Exhale, easy. Good. Good. Good, right here, let it go. There it is, good. So I drop her low back, so it's a technique where the table lifts up and drops down. Go over the SI joint and put some pressure over that area. Find the joint that is restricted, and the direction it's restricted, and apply gentle motion. I like to get adjusted this way. Getting this. They caught me. They found us. Carol, I'm just going to adjust your knee now too, okay?
Okay.
Firm pressure here, okay?
Okay.
Good, and relax. Last one. A little more. There we go. Last adjustment. Breathe in. Exhale, easy. Let it go. Let your chest fall. There's the pressure right over my hands here, okay? You're gonna feel the table move a little bit. There it is. Good.
Ooh.
It's a little tight there.
I don't know why I'm so tight up there.
That's just calm in that spot on your upper back, okay?
Okay.
You wanna give your speech?
What speed?
Yeah, thank you for this nomination for best chiropractic adjustment video in the world.
That's right. It is. I never dreamed I'd feel this good. Really.
Oh, that's awesome.
Really.
Yeah.
I feel so much better since I've been coming.
Nice.
So.
Thanks for saying
back
that.
adjustments. It's just I can't believe they did all this. So I'm happy.
You deserve it, honestly. Yeah, we deserve to take care of each other. Come on now, people. Thanks for watching.
Thank you.